They are a crucial part of the only Level 1 trauma center in Central Florida, and they're celebrating a big milestone. The Orlando Health Air Care team is turning 40 years old, and we are honored to be joined by Chief Flight Nurse Nina Hilton. Nina, thank you so much for being here.
Thank you for coming out and joining us today.
So we are obviously standing in front of one of your 4 helicopters here that you and the air care team use. Tell us a little bit about how it works. How do you get dispatched?
Okay, so our program does both scene work and interfacility calls. So if there's an accident and the EMS agency needs us to respond, they will call our dispatch center located downtown at ORMC on our helipad, and then we would be dispatched that way.
Okay, so you're here and you have about 8 minutes to get the 3 people who board this helicopter inside and in flight.
Yes, so we will get coordinates to where the location is that we need to go to. We will circle, we'll orbit the area, just make sure that safety is our key thing, that we want to be safe in landing and that the area looks good and clear of any debris or any obstructions that can hinder us from landing safely.
Research has shown that if you're able to administer care to someone within an hour of them having been seriously injured, they have a 15 to 20% higher chance of survival.
Yes, so that is very key right there, is that survival aspect and getting there to them in that golden hour, like you had just mentioned. So bringing that care to the patient, whether it's in the back of the ambulance or the side of the road, or when we do interfacility transports inside at bedside.
So once you have the patient in the helicopter, it's a little bit different, because even though this looks pretty massive behind us, it is an incredibly small space that you're working in. Tell me a little bit about how you work inside the helicopter.
So inside, the medic sits at the head of the stretcher where the patient's head would be. Managing that airway, that medic is key. They're right there, able to render that care immediately. The nurse, depending on where he or she sits, can be at the side of the patient, able to administer medications appropriately and efficiently. You
have a team of about 35 specialists who really love this work and are true heroes on a day-to-day basis. Amongst your 35-member team, I mean, it has to be like a family.
Yes, so we are very close. You spend 24 hours with that person. So you get to know them, you get to know their family, and you become very close. And that is key, as working as a team with that unity.
It's another reason to choose well with Orlando Health. If you would like more information, you can visit orlandohealth.com/aircare.